to the show. We're going to talk about it. We're your hosts, Joanna.
Joel.
If you loved last week's episode, you're definitely going to love this one. Today, we're going to talk about depression and dream psychology. And with us, we have a very beautiful, super special guest with us today. We'll let her introduce herself.
Thank you, Joanna.
Hi.
My name is Sarah.
Nice to meet you, Sarah.
And I'm a clinical psychologist.
That's amazing.
Yeah, thank you.
Okay, so I think we'll get into it right away. So, approximately 29.91 million people in Africa are reported to be depressed. Yeah, I think these are large numbers. And I think with the occurrence of COVID-19, the pandemic, this increased by around about 33%, so research stats. So based on these numbers today, especially, by the way, in our country, Uganda, and these rates are very prevalent amongst people with HIV, people without jobs, and all those things. So based on the numbers that we have, what can you tell us about depression fully?
Yeah, depression, I would say it's a common mental health disorder.
Yeah.
It affects everyone. It can affect anyone.
Okay.
Yeah, and around 4.4 million people are suffering from depression.
Worldwide or?
Yeah.
Okay.
Yeah, and depression, when we look at depression, it has some risk factors and the triggers.
So my numbers had a discrepancy. I think it was 29%. Yeah, but okay.
Yeah, it's okay. Yeah, so when you look at depression, for me, okay, a definition of depression, for someone to say that this person is depressed, she has to be clinically diagnosed. Sometimes we wake up and say, I'm depressed, but that's not true.
Nice.
So depression has to be clinically diagnosed.
Yeah.
And it's a mood disorder that causes persistent sadness and loss of interest in the things that we used to enjoy. And it has symptoms for you to wake up and say that this person has depression, and it has symptoms like loss of interest in the things, feelings of worthlessness, feelings of guilt, changes in diet. Sometimes people who are depressed, some of them, they eat more.
Too much. Yeah.
And sometimes some other people, they don't want to eat.
Yeah, they barely eat.
Then there are some changes in sleep. Some people like to sleep like too much when they are depressed, and others do not have sleep.
You raise a good point, Sarah, when you say you don't just wake up. See, with the occurrence of the pandemic, when people were left to a large share of their thoughts at home, very many people, I think, couldn't identify with work. They couldn't identify with school. We're just closeted in our homes. So people looked for what they could identify with, and a lot of people settled with depression. This is, I feel like the numbers increased, and this is definitely with respect to people that were actually affected. But we also know that there is a large number of people that just, got up and said, I am depressed. You've been sad 2 days and, I'm depressed, or I have anxiety. So you raise a good point when you say it has to be persistent. But could you clarify on that duration of persistency? Like, how long is persistent?
So for depression to be diagnosed, it has to be 2 weeks.
2 weeks.
And this is persistent sadness. You're sad almost the day, nearly every day, and most of the day.
Okay.
So you can be sad
Like
after loss of a job.
Every day, 2 weeks.
Yeah, for 2 weeks.
Okay.
Yeah, so it's normal for someone to be sad, but for someone to be called depressed, it has to be persistent sadness. We all feel sad at one time.
Yeah.
After loss of a job, after loss of a loved one, you can feel sad. But with depression, it is a persistent sadness for 2 weeks.
Okay.
Someone doesn't even go out to associate with people. someone is always indoors, someone doesn't have interest in the things you used to enjoy. I used to enjoy jogging, but now I have no interest in jogging. I'm
Yeah.
just there.
Yeah.
So that is what we call depression.
Okay.
Yeah.
So
Interesting.
I have a question on that point. So most of the times, where do we draw the line between depression and anxiety? Because in most, I think, ages of adolescence, there is that phase where people say, I'm experiencing extreme anxiety. I think I'm depressed. And also, most times people get anxious. For example, if you're going to present on a show, there's that kind of anxiety.
Yes.
If you're going to, talk to someone new, there's that anxiety. So where do we draw the line that this anxiety is now problematic and should be diagnosed, or this is just a normal way of living and you should find a way to handle that anxiety?
So anxiety is also another disorder within mental health. It's also another disorder. But like I said, in depression, for a disorder to be called a disorder, when you say a disorder, it is something that is out of order.
Yeah.
Yeah.
So for something to be called a disorder, it's okay to be anxious, like I said. It's okay to be sad.
Yes.
Yeah. But with anxiety, it has also to be, it takes 6 months to be diagnosed with anxiety. And there are so many types of anxiety disorders. And every time when we say this person has anxiety, this person is always fidgeting. So sometimes some people have anxiety attached to specific things. Like maybe my anxiety is attached to heights.
Oh, okay.
I would say heights. So for me, I cannot even think of heights. If I have
get
anxiety
fidgety and-
yes,
Okay.
I cannot even try to do what? To think about the heights.
Okay.
So for someone to say that I have anxiety and it's really a disorder, most of the time you're anxious all the time.
All the time.
Even simple things, they cause you to be anxious.
Oh, okay. All right. That's amazing. So I also want to ask, would phobia, like any kinds of phobia, are they also maybe a little tiny branch on anxiety? Like you said something about heights.
Yeah.
And you get, so like, do phobias also fall in there? Or they're an entirely different thing?
It's it's anxiety.
Oh, okay.
If I can say I have anxiety of heights, it's phobia of heights.
Joel,
Yeah.
do you have a phobia?
Yeah. I used to have one of heights. I think I outgrew it.
Overcame it.
Yeah.
Okay.
Yeah, so you find many children with phobia of, like, I would say animals. They fear cats. Like, they fear cats.
Yeah.
So they have phobia of like animals or maybe cats. Like children, they fear specific, okay, everyone has something he or she fears.
Yeah.
Yeah.
Hogs for
So
me.
you find one child fearing the cats and someone fearing the cows, like that.
Oh, interesting.
Yeah. So phobia is also
Also-
same as anxiety.
Okay.
So
Yeah.
the mental health awareness, it has quite caught on in Uganda and Africa at large. Yeah. Though it started in the States and now it's here, there is a bit of awareness. So but it's not yet perfect. We're not yet there. And this kind of issue of, now let me say some children who are born with disorders, probably in some African traditions would be called, maybe this one is a curse, and they don't have that kind of awareness. Let me say someone is autistic and they're behaving in a weird manner. Some families will say, no, this one is just weird, or maybe you gave birth to a curse, or you did this when you were what. So how do we improve that mental health awareness so that these people don't have to still suffer the peril of their conservative parents or cultures?
Sarah, before you get into that, that's a very good question. But right at the beginning of his question, he said something about being born with disorders. Do you
Yes.
think that it is indeed possible to be born with a disorder, except like, of course, things like autism and, but like anxiety, does somebody, are we, born with these disorders, or this is something that we pick up because of the way that we grow and the things that we experience?
We are not born with disorders, I
Okay.
would say so. But as we grow up, even when you say autism, we are not born with autism. Okay. But as a child is born, as a child, I'm trying to respond to the environment. I've been inside and I've been used to the environment of inside the stomach, my mom. But now I'm outside and I'm trying to do what? To respond to the environment outside. So there are so many risk factors that exposes these people or everyone like to get any mental health condition like autism. Even when we are looking at these mental disorders, we look at so many things. There is no single factor that causes a mental health disorder.
Okay, makes sense now. Thank you.
That makes sense. So the other question,
what
do you think we could be doing better to make everyone aware that some people it's just a mental health issue and it's not their own doing?
We need to do more of the sensitization. Of course, I think we've done good, and we are trying to do our best to sensitize the community about these mental health disorders. Like the people who used to hear about Butabika, they would say, no, my child is not what.
Mad,
but when you go to Butabika nowadays, you find that there are so many mothers. They have a children's clinic, and most of these people, they have epilepsy, they have autism, they have those developmental disorders. So many people have come to appreciate these mental disorders. They have come to appreciate that, yes, a mental health disorder can be there and it can be cured if I do what? If I do this and this. So yes, we are doing sensitization and we continue to do more sensitization. If you look at years before, we are so different from now. If I get any different thing about my child, I have to think about it. I have to ask my friend, my child is doing this and this. And a friend is going to tell you, you know what, there is this and this. And when you see mothers who come to Butabika, they report that, oh, this one had a child who is like this, and she has directed me to do what?
To get some attention.
Yes. Have I answered you? Okay, thank you.
There is this issue of depression medicine. So I don't know if it's clinical psychologists or psychotherapists that are authorized to kind of give out the meds, but there has also been conspiracies that the depression meds that we are being given, it's more of promoting the pharmacy industry. So it works in a way that if I give you the depression med, it's going to numb your feelings for a short while, but then as time goes on, you need more and more. If I used to buy one, and now I need 5, and now I need 6. So where do we draw the line? Maybe therapists out there, when do we start to say, this one has reached an extent of giving meds? And also, do you believe that meds actually help someone cure depression? Could they be?
So depression is treated both by the medicine and psychotherapy. With depression, there are brain chemicals that there are imbalances in brain chemicals. So with this medicine, there are so many brain chemicals. Like we have serotonin, which is for happiness. We have dopamine. We have what? So for someone to have depression, these brain chemicals, there are imbalances within these brain chemicals. So this medicine helps us to bring balance to these
chemicals,
to these brain chemicals. So I cannot treat depression alone.
As a psychotherapist?
Yes. I cannot treat depression alone. For me to see a depressed patient and take him through therapy, he must first undergo the treatment by the psychiatrist. And these psychiatrists, they are the one administers the medicine. As a clinical psychologist, I cannot administer medicine. But as a psychiatrist, they come in to help us and give treatment after the person has stabilized, and as psychologists, we come in to help them cope up with the
depression.
Yes.
Amazing.
So in your field of experience, would you advise, or do you believe that medicines are doing more harm, depression medicines are doing more harm than good because of that issue of causing that kind of addiction? Now I need a med to survive.
As Africans, I don't want to feel headache. I'm going to take headaches. Just a simple headache, I take medicine. These people, the depressed people, are given medicine for specific period of time. Like 2 weeks, you're done with the medicine. But now this person is going back home. After the hospital, this person is discharged and this person goes back home. Just a little bit of sadness, I take medicine.
Oh, yes. We become very dependent on them.
So it's not on our side. It's not on the hospital side. Sometimes it's us, the patient who tries to do this.
Okay.
You've been given medicine for 2 weeks, you finished it and you feel like, no, I'm still low. And then you continue with the medicine.
Okay.
Of course, as you continue with the medicine, the brain gross dependence on the what? On the medicine.
The drug,
and you cannot live with the what? With the drug.
Yeah. Thank you so much, Sarah. You actually raised a good point when you said something about the different generations and how they handle sadness and the current generations. And that brings my next question. Could you take us through, a bit of maybe timeline, on depression and that it's different parallels in like different generations? Because research shows that a majority of people in the generation Z, which is Gen Z, which is the majority of us, identify more with these disorders and anxieties and the whatnot compared to the other generation. And it's crazy because there might be a bit of some controversial, theories. Apparently, the older generations, it was because of their low awareness to mental health. But with our generation, it's because of that extreme awareness that we pick a few symptoms from a few disorders and then we just identify with the disorder in general. Yeah. So could you, what's changing? What's the difference?
Yeah, could that
What's
be attributed to environmental factors?
When you look at the older generation, by the way, these mental health conditions were not common
At all.
But our lifestyle nowadays is totally different.
Yeah.
It is totally different nowadays. And since we've come up to know about these things, you go to a hospital and they tell you you're depressed, and then you go outside, you tell your friend, you know what? Oh, you just see one symptom and you say you're depressed. Yeah.
Our grandmothers would have just called that witchcraft. And
the lifestyle nowadays is totally different from the older generation.
Yeah.
We don't want to exercise. We don't want to associate with people. You're always on your phone.
Yeah.
TikTok is now...
Oh, yeah, the social media.
Yeah, you don't want to associate with
the
people.
Video games.
The drugs that you take nowadays, just a simple headache, you take that drug. Those things were not there before. They were not there before.
Yeah.
But nowadays, the lifestyle is totally different.
And that's our problem.
Since we lack information about this, I'm depressed. You don't know what depression means. And then you go around saying depression.
Yeah. Oh, okay. That's amazing.
Yeah. Do you believe that psychopathic people can become psychopathic in very many ways? But if you've reached that stage where, and also maybe before you answer this question I'm coming with, what makes someone a psychopath? Because some people maybe are just disagreeable to a certain extent. Maybe I will lie to get my way through life, or maybe that's what makes me a psychopath. So I want us to know what makes you a psychopath. When do you get to be in that category and they call you a psychopath?
Sometimes it's a figure
I'm not
of speech,
sure
Joel.
whether we have psychopaths in Uganda. I'm not sure whether we have even one. A psychopath in Uganda.
We don't?
I don't think so. For someone to be called a psychopath, it is, should I say, extreme one. This person has all, I don't know, kills people, kills does
Kills
what?
Animals, maybe rapes.
I'm not sure.
Animals.
I bet there is, I feel like there is definitely, see, our media coverage of everyone in Uganda is a little bit low compared, let me say, to the Western societies. But I bet there is surely that one person that rapes animals, rapes people, kills
maybe
people.
he's there.
Rapes animals.
For someone to be called a psychopath.
You know about that Australian zoo guy that was charged on raping multiple dogs and killing them? It's a
Me,
thing.
I know the monkey that
Well-
was raping people. But yeah.
What? Okay, yeah.
So for someone to be called a psychopath, it's beyond. And I'm not sure whether we have one in
So
Uganda.
let me say, okay, me, I feel my understanding of a psychopath would be someone whose inclination to malevolence and a cynical life is high. So yeah, someone's inclination to malevolence, it's high probably because of the experiences they have had. Now this raises me to the next question. If I told someone that I'm inclined to do bad things, like every time I look at someone they piss me off, a normal person's reaction would be maybe to say something back that's disrespectful, but mine is to kill. I have that sudden urge to kill. We have seen documentaries of people like Jeffrey Dahmer, all that excessive,
Bundy.
extreme psychopathic tendencies. But then if I told someone, that would be like the best alternative you'd have is going to therapy. But in Africa or Uganda, people do not believe in therapy.
Yeah.
Why would I pay to talk to someone? I'm sharing my feelings with someone. And what do you think about that? Do you think therapy is something that should be considered?
Yeah, it is something that should be considered. And like we said, people have come to appreciate the therapy.
Yeah.
Like nowadays
Yeah.
in Africa,
Yes.
they've come to appreciate therapy and it really helps. But sometimes this person has to be locked behind doors before you even try anything. Because this person you cannot sit with and talk.
Sometimes they're
Therapy
violent,
is
yeah.
about talking. It's just talking. And I need you in a sound mind for me to start therapy with
To get
you.
the message across.
Yeah.
Amazing.
So yeah, there is a movie about the psychopath. Do I know the name? It is called Split. You should get time and watch it.
The
Yeah.
multiple personalities.
Yeah.
Yeah.
You
You've
watched
watched
it
it?
one
Yeah, I think I've
time.
seen it.
Yeah, so this person
think
has
or you
to
have?
be
I
locked
have.
behind the doors. Even in therapy, you try therapy, he will kid you.
Oh, yeah.
He will kid you.
Oh, yeah.
You cannot even do one session with him.
Okay,
Oh,
but then
yeah.
that raises a good point. Wasn't the guy in Split diagnosed with multiple personality disorder?
Yes.
So doesn't that isn't it a little bit different?
But it brings you much closer to psychopath, to
Oh,
what we
yeah.
call a psychopath.
Oh, yeah.
If you watched that movie, you see how he looked like he used to kidnap the girls and take them to his home, lock them from there. He goes to therapy. This person, the therapist is telling him, what have you done? I'm seeing something different about you. And one time he killed the therapist. So it brings you much closer to what
Being a
we call a
psychopath.
psychopath.
Okay.
Yeah.
So-
So even that person, it was very, very risky to have him into therapy. And the
Amazing.
therapist, they told her, you know what, this person is not okay to be with you in therapy. But she insisted. So you see, we might think that we are doing the right thing, but in the long run, we are doing
It's
something
very damaging.
yeah.
Okay.
So what we have to do, the psychopath, the first thing we have to do is to lock this person behind the doors.
Bars. Okay. Amazing.
I know
And-
therapy can help, but at a later stage.
Okay.
Yeah.
So, but just so we get this clear, it's the guys that were lurking behind are the psychopaths, right? But for people that are struggling with these things and, anxiety and depression, and maybe it's been clinically diagnosed, yeah, it's important to remember that we're not going to lock you.
Yes,
We
yes.
just want to talk.
Yes.
Yeah. And then as, we wrap up, I wanted to ask, are there any, specific mental health challenges unique to this generation, our generation? Or like maybe those specific factors that really contribute to higher depression rates amongst the younger generation?
Yeah, there are so many risk factors. That contribute. And the first one is about having family history. If you had someone depressed in a family, someone who had depression in a family,
Yeah.
it's a risk factor for you.
factor.
Just a simple trigger.
What's
So
the
I want to confirm, risk factor or
generation
genetic?
or genetic?
It's a risk factor.
Oh, it's not genetic. I can't because people in my line are depressed, it's not an assurance that I'll
it's
also,
not an
No,
assurance.
you seem so worried.
It's not. So, yes, these risk factors are there and we may all
yeah.
be exposed to them.
the risk factors.
But they are triggers also. They are triggers. There is something that triggers the depression. There is something that triggers the anxiety.
Yeah.
The risk factor alone cannot be independent to play a role.
Yeah.
But also there are triggers
Yeah.
that triggers these risk factors that are behind us for them to come into light or cause depression.
Of course.
So,
Yeah.
I think since we are delighted to have you here, I think maybe share with us insights on this dream psychology kind of thing. So, Sigmund Freud believed that dreams have meaning, and probably when you grow older, they could be repressed or displaced, and you can't figure out how to give it a meaning, but it's a dream. So, in your perspective as a clinical psychologist, would you suggest that dreams indeed do have meaning, or they're just a reflection of the events we have experienced through that day?
Yes, they do. They do have meaning, though within
More inclined to believe
psychology,
the
of
spiritual
course.
meaning. So I'm very excited to hear this one.
Oh, from psychological
Yeah.
point of view, not
Yeah.
Yeah.
From psychological point of view, yes, the dreams have meaning, and so many theorists they came up with how they used to interpret the dreams, what the dreams serve, like there is a purpose behind having a dream. Yeah, and one of the most popular, and he was Sigmund Freud, who came up with dream analysis theory.
Okay.
And for him, his theory, he suggested that
Joel loves that guy.
he suggested that the dreams come because of the unconscious mind being at work. They are due to unconscious mind at work. From childhood experiences, we have had desires.
Yeah.
We have had impulses.
Yeah.
We have had, so many people, so many things that we have had, but they are replaced. We've not given them a chance to do what? To come into the conscious mind, or even put them in what? Into the practice.
Yeah.
So for him, he was treating his people, when he came up with his theory, he was treating his people using the dream analysis theory to see what the dream really is
Sarah,
behind.
you raised a good point, and I wanted to ask. You said some of these things were like repressed by the child mind, right?
Yes.
So I wanted to ask, imagine, not even imagine, in the case that this was a conscious event, an event that was recognized by the conscious mind, for example, abuse, maybe say sexual abuse as a child, and, maybe I'm dreaming about it much later. Does it still mean that my unconscious mind, that it affected my unconscious mind and not the conscious mind?
So there is no single theory that better explains why we dream.
Okay.
So I would relate that to a cognitive theory that talks about, cognitive theories about how we think, how we feel, and how we behave.
Okay.
And so you've been raped and later you try to dream about it.
Mm-hmm.
So when you see the cognitive theory, it is trying to process the information that has been, it has happened before, but it's not processed very well in the brain. I would relate this to people who has PTSD, post-traumatic stress disorder.
Yeah.
Like these traumatic events, by the time they happen when we are unaware.
Yeah.
We are unaware. It is a short period of time for us to concentrate and process this information. So when you get time, this brain is trying to process this information that was not well processed during the traumatic event.
So
and that is why that is why they continue to appear into dreams.
Okay.
Yeah.
That's
so there is
amazing,
no
Sarah.
single theory that better explains why we dream.
Yeah.
Oh.
Yeah.
I think you've explained this theory in a
in
a very psychological manner, and we have gained amazing insights. Guys, thank you for tuning in. We are going to talk about it. And if you want to support these podcasts, you can follow the link in our Patreon account or the PayPal link that we have on all our bios.
Yeah.
Thank you for tuning in, and we look forward to bringing you more amazing conversations and perspectives.
Also, if you have any further questions you'd like to reach out, maybe you want to know something deeper about the things that we've talked about, feel free to reach out in the links on our social media profiles. Thank you.
On the dot.
Okay.